It's a med mal case where a lady went in to have a pacemaker placed, a battery change of the pacemaker. And so it was an outpatient procedure, should have been in and out within a few hours. They do thousands of these procedures every year, very common at this facility at Summerlin Hospital. She goes in, the anesthesiologist overdoses her on propofol. They gave her, he messed up the dosage because he based it on kilograms versus pounds. And so he gave it to, she's a 115-pound lady, and he gave it for 115 kilogram. So it was about 2.5 times as much propofol as should have been given. Overdoses her. She suffered a massive hypoxic brain injury.
Are you suggesting my client suffered a stroke at some point in the past?
Yes, the CAT scan is consistent with that. Small vessel disease, small vessel strokes.
Doctor, you are utterly unqualified to state that here today. True?
No, I read it in the
You've read it nowhere.
small vessel disease.
Counsel, hold on. Ask your question.
You've read that nowhere. Do you understand the difference between an image of a stroke on the brain in the CT scan and white matter changes that due to the aging process? Do you have a clue what that looks like?
Yeah, but there's also small vessel disease on the CT scan.
That doesn't mean a stroke, doctor, does it?
Usual cause of small vessel disease is stroke.
Doctor, did you read anywhere in which anyone ever diagnosed this woman as having a stroke prior to this event?
I did not see the word stroke. No.
Okay. You saw white schema disease in the brain, correct?
Yes.
Which could be caused by multiple different issues, correct? One of which is diabetes.
Yes, but
Okay.
the etiology of that is the vessel's getting smaller and smaller and smaller, and they're not getting enough blood flow to certain areas.
Okay, doctor, as a cardiologist, are you aware of the fact that that does not mean definitively that an individual has had a stroke?
I don't know how to answer that. I guess I can't make that diagnosis.
Okay, counsel, move on.
I'd ask to strike his entire opinion.
Move on.
Roger, what do you think of the word utterly? I know you're going to have some comment on that.
Well, you know, look, I mean, he's got the jury with him. He's been given reason to be pissed off. In his next trial, he is not going to use the word utterly. He's not going to do that. He's going to be a little calmer like the judge was. That was a great cross by the judge.
That was the best. That was almost as good as Sean's. That was an amazing cross.
No, it was a great cross. And look at the way he did it, very calmly. Still was effective with it. Short questions, basic words, no utterlies. Look, get rid of your adjectives and adverbs when you get pissed. That's what gets you arrested, all right? You can say, you're a cop, you don't get arrested. Put an adjective or adverb in there, your ass is going to jail. Stay away from that when you're pissed off, that's all.
Do you understand that the best evidence is the doctor coming in and actually testifying about their own patient?
I mean, if we're looking at the medical records, the records said that there was memory issues and she put her in for disability.
Well, so when you have a record and then the doctor comes in and testifies, do you ignore the record?
No, I'm not ignoring the record.
You're ignoring the testimony.
No, I guess there's a disconnect there somehow.
So which one do you choose?
I don't know how to answer that question.
Now, what do we do when witnesses say, I don't know how to answer that? Well, first of all, see it for what it is. He does know how to answer it. He could tell the truth. He chooses not to answer it because the truth would hurt him. And so you have to really, at least I do, whenever they start that business with me, disconnect, I don't know how to answer it, that's hard to explain. I say, well, are you refusing to answer that question, sir? Watch their eyes when you ask them that. They're like, nope, I'm not refusing. I know refusal gets my ass in trouble. No, I'm not refusing. Well then, sir, let me help you with the answer. The answer is, it doesn't. It means you didn't read her report or you chose to ignore it. That's what it means. Well, I don't know about that. Give me another explanation, sir. I'm baiting him into talking now. All right? I'm going to bait a witness when he says, I can't answer. I'm going to throw softballs, hoping he'll say something, because he's going to say something wrong, because he's totally off the script now. This is the way the rule works. When I say no more questions on cross, that's it. It's over. The witness never gets to say no more answers. They never get to say that. Don't let him say that. You had him boxed in, crush him. Now, if you say to me, well, I didn't do that because point was made, I'm totally good with that. Totally good with that. I just think we can all press people harder on cross than we do.
Tell us what these boards are, Sean.
So these boards were used by the defense in their direct, and they took portions of medical records, and he commented how that proves their point that she has no brain injury. And it was it was awful because they misrepresented half the records, but you'll see what I do with them. I basically take their exhibits and make them my own.
Judge, can you hear me?
Go ahead.
Okay, so this is July 22nd, 2016. You would agree that the substantial weight of evidence supports a brain injury on that day, right?
Yes.
Okay, so that one doesn't matter. July 26, 2016, you would agree that substantial weight of evidence strongly supports a brain injury on this day?
Some degree of that, yes.
So you would agree that on July 26th, the brain injury is more likely there's this record really isn't that relevant?
I agree that there is more than likely some degree of brain injury.
Couldn't agree more with Sean that you have to make their exhibits, their experts, your exhibits, your experts. That's what constructive cross is all about. Their witnesses, their paper, our theory, our narrative. And you're doing a nice job. Now, the best part of this job is the efficiency with which you move through those boards. You went through multiple boards very, very quickly. Man, juries love it when you're moving fast.